Hello, welcome to today's lecture. I don't know what number it is. I have lost track and I forgot to check. But we will be talking about something. I don't know what the topic is yet. I'll pick one of about 20 that I have left to do, and we will go from there. I told administration I'm tired of lecturing by myself, to myself, all alone, so they got me this. Okay, this lecture will cover the muscles of the trunk and give you some idea of where they're located and what they're being used for in the dog. When discussing items on the trunk, we will use two words in relation to that: epaxial and hypaxial. And what we are referring to above the axis or upon the axis and below the axis, we are using the transverse processes of the vertebra as our point of reference. So anything above the transverse process is epaxial. Anything below the transverse processes will be called hypaxial. So that axis is running right down those vertebrae, above and below. Essentially what the halfway point is how we're going to divide this. And if you step back and look at your dog, you'll notice that most of the structures on the trunk are hypaxial. That's where the bulk of that animal is. There's not as much that is epaxial. So epaxial muscles, when they contract, the ones that are right along the vertebral bodies and the processes, those, when they contract, will extend the vertebral column. The hypaxials will flex the vertebral column. So extending the vertebral column is if you're going to stand up straight. Flexing the vertebral column is if you're going to bend down and touch your toes. Okay, so that's the action. Now, if only one side of axial muscles contract, you will get a lateral flexion of the vertebral column. That is if you're going to stand and bend over to your right or left side. So I will explain that here shortly. So epaxials for extension of the vertebral column, hypaxials for flexion, and the other hypaxial muscles dealing with respiration and the muscles of the abdomen, we will see them doing other things as they are away from the vertebral column. So muscles that we have already seen, hypaxial, is the sternocephalicus, sternohyoideus, thyroideus. You've already been tested over the sternocephalicus. You're familiar with that one. The sternohyoideus and thyroideus, we will talk about their actions on the larynx when we start dissecting the head. You've also encountered the longus capitis muscle and longus coli muscles. And those are hypaxial in the cervical region. The longus coli actually extends through the thoracic inlet down to the 6th thoracic vertebra. So it goes a little bit farther, but we'll just kind of group these both in the cervical region. So these were located ventral, cervical. These are located in the ventral aspect of the cervical region. So if these were to contract, they would flex the cervical vertebral column. And that's all there is to their actions. So those are hypaxials in the cervical region, along with those 3 sternos, and we will discuss the epaxial system right now. Okay, these epaxial systems, we see dorsal to the transverse process of the vertebra. And these are running up and down the length of the animal. Right here you can see our transverse processes there. They're above it. And they're coming out onto the side of the animal, but the ribs kind of following out here just a little bit right there. And so as long as it's above that, we'll still call it epaxial. And when this contracts, it's going to have a different action than a muscle that's located down here would have. So these muscles are going to extend the vertebral column. And remember, we have, this is bilaterally symmetrical, so we'd have another set of them over here. So when they contract, the vertebral column will extend. If just one side contracts, we would get that lateral flexion of the vertebral column. So lateral flexion will actually come from the epiaxial muscle system, one side contracting by itself. The true flexion of the vertebral column comes from the hypaxial muscles. Now, there are a bunch of hypaxial muscles, these psoas muscles back here in the abdominal region, and longus colli actually extends back to T6 in the thoracic region. We're not going to cover the hypaxials back in there that are working the vertebral column. We'll just worry about the ones up in the neck that you're likely to encounter in surgery. And if you start doing ventral slots of the vertebral column, you'll get to some of these down here, but not that common of an occurrence compared to just digging around somewhere up in the cervical region. So we'll leave those out to simplify this somewhat. So there will be three systems, and we call them systems because there's a series of pieces, and they have this kind of drawn in schematically. We've got one here starting and stopping, another one picks up here, comes real far, another one starts and stops over here. They've got all these different names right here. We're not worried about all these names back in here. We're going to give names to some of them up in the cervical region, in the transversus spinalis system, and we really will just be naming them by their location in the other systems. All of my pens are drying out. So when you look at the top of your dog and you're dissecting, and most of you have seen this by now, you're going to see the muscles up here, and you will see a groove or separation between two of them there. You're going to see another one right here when you're looking down on these from above. So the one closest to the spinous process of the vertebra or the midline or animal, that's the transversus spinalis muscle system. Next one over is longissimus system. The one located most laterally is the iliocostalis muscle system. Now the transversus spinalis system, that's going to run from the skull, and we're just going to stop it at the sacrum. Those things will run on down the tail, but we're not worried about the tail. So from the skull to the sacrum, you'll see it there. Longissimus system, that will run again from the skull down into that sacral region, touching over towards your ilium. And then iliocostalis, this will actually start at rib 1, so the very front of your thoracic region, back to that ilium. So here's where you find these things. And so what we will do is when you dissect, you're going to look for these three systems. So when you find the three systems back here in our lumbar region, the last rib is here, so here's our lumbar region. If I have a pin sitting in the transversus spinalis part, right there in the lumbar region, and I say identify, your answer is going to be transversus spinalis system, lumbar part. If it's over here in the longissimus system, it's longissimus system, lumbar part. Okay, we'll just keep it simple. All this thoracis et lumborum is just saying the thoracic region to the lumbar region, because that's where all these are actually extending at some point along the length. Just call it lumbar part. When I get up here, they actually don't have the longissimus system drawn in on this picture here. It does exist up here. Let's put another little red chunk in here. So when I've got the pins in these regions up here, if it's in the red portion there, that's longissimus system, thoracic part, because I see ribs. Okay, so just named by the region, lumbar parts, thoracic parts. You'll have all three systems in those two regions. Now when you get up to the cervical region, the transversus spinalis system is going to have named parts to it. And the splenius is the one that is going to be most superficial. And we're just going to name them by their names. We're not worried about what part is going to the cervical region and what part is going up to the head. It's just the splenius. And when you cut that one right here and reflect it dorsally, the semispinalis capitis shows underneath that. So the splenius and semispinalis capitis, that is the transversus spinalis system up in the head and neck region. Okay, splenius, semispinalis capitis. You do not have to know the two parts to the semispinalis capitis. They are bold printed in the book. We're not worried about the two parts. You will look between those two parts to see your nuchal ligament up there, but we're not worried about the names. So biventer cervicus and complexus you'll be able to scratch off of your list. The longissimus system up in the cervical region and head region. Got a picture of it somewhere over here. Somewhere. There we go. This is a diagram out of your book, figure 282 in this version, so it'll be somewhere around there in yours. Here's the diagram where the splenius is reflected up and your semispinalis capitis is underneath with a couple pieces right up in this region here. Underneath that, on this diagram here, you'll see where the iliocostalis stops at rib 1. You'll see the longissimus system come up past that, and you see all these pieces coming down and heading ventrally. That's the cervical part, attaching all this to the cervical vertebra here. And the last part will take a straight shot up towards the skull, and that is the longissimus capitis piece there. So 3 and 4, that's your longissimus part to the head and the part to the neck. And then this is your transversus spinalis system, this system over here. So just keep that easy. The longissimus kind of follows, the region. It's got lumbar, thoracic, then cervical, and then capital. The cervical and capital parts of the transversus spinalis, remember, they have their special names, splenius and semispinalis capitis. So there are our extensors of the vertebral column and the lateral flexors of the vertebral column. Now, if we go ahead and pull this out right here, we've gone through epiaxial and hypaxial definitions. The hypaxial's in the neck, the epiaxial's along the length of that dog. So now we've got some other muscles that are down on our trunk that have other functions. We're going to have some in the thoracic region and some back here in the abdominal region. I will talk about the ones in the thoracic region first, the muscles of respiration. And you will see these as we go through dissection. The first one, let me change pens here. The first one is the scalenus. Not to be confused with the splenius, the scalenus muscle. That's going to come off of transverse processes of the cotylomost cervical vertebra, and it will come down to the first 2, sometimes 3 ribs. And you'll see different parts to it, and the book may even give different names of the different parts. They're different part names in different animal species, whether you're looking at the horse, the cow, or the dog, but it's always a scalenus muscle. I've got it drawn here on the left side. All these will be bilateral. This muscle is going to act to pull the ribs cranially. It's going to pull these first 2 to 3 ribs in a cranial direction. Okay, that's its action. This is going to be a muscle involved with respiration. So that's what it does. Won't take any dissection. You're going to look down, you're going to see where it is right there. The serratus dorsalis cranialis. Serratus dorsalis cranialis muscle. That's going to attach to ribs 1 to 10, and you're going to see little pieces of muscle down here, like so. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And coming off of that, I'm not sure where I threw my blue pen. It was dying on me. I tossed it somewhere. I'll use a black pen. I'll use this one here, see if I can get it writing again. There we go. Off of that, you're going to see, that's not working too well. Let's draw it in black like this. You're going to see an aponeurosis come off of that thing. It'll tell you to cut through it. It comes up the dorsal midline of the dog. So you're going to see little muscle fibers and an aponeurosis. What it's going to do is it is going to lift those ribs and pull them in a cranial dorsal direction. So it's going to lift those first few rib pairs and pull them forward. Then we have our intercostal muscles. We are going to have external intercostal muscles and internal intercostal muscles. So when you take a look at your dog, you are going to see skeletal muscle between the ribs, inter meaning between, so between the ribs, angled like this, and it doesn't make it all the way to the bottom. And these fibers of the external intercostal will be directed caudally and ventrally, just like we have them drawn, caudally and ventrally. When you tear through those, and you'll have to see it up higher, before I do that, so there's one there, there's another intercostal muscle right here, and there's another one here, another one there, another one there, so there'll be 12 sets of those external intercostals. When you tear through those, you're going to see the internal intercostal muscle with fibers oriented opposite to the externals, so the internal intercostal muscle will have fibers oriented in a cranioventral direction, just like we have them drawn. This muscle actually makes it down to the sternum, so if you come back and look closely at your external intercostals, look at the bottom, you're going to see the internals come out from underneath them. Okay, they'll actually peek out from underneath. So external on the outside, tear those out, and you'll see the internals underneath it, so 10 pairs of internal intercostal muscles. So, what do these muscles do when they contract? You've got a muscle between ribs. I guess I'll lay my pins down like this. You've got muscles between ribs. The external intercostal coming off this rib to this one over here is going to pull this rib up like this. It's going to do that. At the same time, the internal intercostal attached from here to here is going to pull this rib down like this, together and down. So one's pulling like this, one's pulling like this. So what happens is the up and down cancels out, and these ribs are pulled together. Okay, so one's pulling up and together, one's pulling down and together, so the up-down cancels out, and they're pulled together because they're both pulling together. So the external and internal intercostal muscle will take these two ribs and pull them together. Okay, well, we have a problem. There's another rib over here, and this set of muscles is trying to pull this rib over here. But this one's trying to pull it over here. And there's another rib over here, and this pair of muscles is trying to pull it over here. So what happens is, during inspiration, when you're breathing in, these two ribs are pulled towards each other, these two are pulled towards each other, these two are pulled towards each other, so these ribs are being pulled in two directions, so the intercostal muscles contract, and it causes all the ribs to freeze up. This one can't go this way because it's being pulled back, and it can't go back because it's being pulled forward, so it's going nowhere. It's like taking your arms and just making a fist and tightening your whole limb, your extensors and your flexors, and you're getting no extension and flexion because everything's fixating. Same thing is happening here. All these ribs are now locked together with these intercostal muscles, so that when the scalenus muscle pulls the first three cranially, all the rib cage will swing that direction. When your serratus dorsalis cranialis pulls dorsally, the whole thing moves as a unit dorsally. Obviously not as far as my fingers are moving there. So the intercostal muscles make sure this rib cage comes up like a big bellows like this, and it's not doing a wave or something like this if all the ribs were just not in unison. So now you understand why we had synovial joints at the tops of those ribs and the bottom of those ribs, because what's really happening is these ribs are kind of being rocked out a little bit, and the side of this thoracic cavity is being pulled away, and that increases the volume inside the thoracic cavity, which causes a negative pressure that causes air to rush in. So the scalenus, serratus dorsalis cranialis, external intercostal, internal intercostal muscles, those are muscles of respiration, specifically the inspiratory part. They're muscles of inspiration. There's another muscle that you will see on the last 4 rib pairs, the serratus dorsalis caudalis. It's a dinky little thing. You got to look real hard to find them. I've never tagged it. Usually ask about it in the written question. It's pulling in that direction, so it would be pulling the ribs back towards a resting position. And these ribs aren't moving a whole lot. It's just a little bit. Okay, the dog's not taking its chest and doing something like this. Very little motion, but it's a little bit of increased volume to that thoracic cavity. They're going to pull in a caudal dorsal direction, so they're pulling the ribs back to a resting position. So the serratus dorsalis caudalis, that I have never tagged, and I don't intend on tagging it this year. I promise I will not tag it. That is a muscle of inspiration, respiration, specifically expiration, expiring, getting the air back out. It would pull this back down to the resting position. Expiration is really a passive action. When it comes back to inspiration, these muscles here are not, their action is not increasing that intrathoracic volume markedly. It's the contraction of that diaphragm. You can see it kind of drawn in back here, medial to those ribs. When that contracts and pulls back, there's where we get the increased volume in the thoracic cavity and the rush of air that's going to come in. Once inspiration is finished, diaphragm relaxes, all the guts push it right back to its resting state. That's where expiration happens. So serratus dorsalis caudalis, that's what the muscle is attempting to do. It's not really helping you push the air out. It's the relaxation of this diaphragm that's getting the air back out. So the diaphragm is that last muscle of respiration, and obviously that's going to be a muscle for the inspiratory phase of respiration. So these are all hypaxial, but they're not flexing or extending the vertebral column because they're not anchored along like those others were. They're out here on the ribs and then anchored over here on one side, because some of them, because they're doing something else. They're involved with breathing. And then that gets us to the abdominal muscles. And we're going to see these back here, and I think about half of you have seen these so far. If I go ahead and from the back of my sternum kind of draw in that ventral contour of the dog, it would look like this. The muscles we're going to see back here, the abdominal muscles, there'll be 4. These muscles are there to support all the abdominal viscera up in that body cavity. When they contract, they are increasing pressure within the abdominal cavity. So that's for things like vomiting, parturition, micturition, forced exhalation. If you want to exhale, you can increase pressure here in the abdominal cavity, push that viscera up into the diaphragm, and decrease that volume of the thoracic cavity rapidly. So these are used with what they'll call the abdominal press. contract those muscles. Abdominal press puts pressure on the cavity, and you can do different things. Defecation comes into play right there. So basically, if you're trying to get things in the abdominal cavity out, or push the abdominal cavity, contents of the abdominal cavity forward to push air out the thoracic cavity on the other side of the diaphragm, that's what these guys are doing. So the one that you will see initially is going to be the external abdominal oblique. External abdominal oblique. It will have fibers that overlap the rib cage in this fashion here. And this muscle, as it comes down, the fibers don't reach the midline. It's got a big aponeurosis, so I'll draw in another color right here. It's got an aponeurosis that comes down like so. Need some more muscle fibers up here. It's coming off the ribs, thoracolumbar fascia up here in the lumbar region, and it comes down, and the last attachments are up here at the ilium. And it's got a caudal-free border right there. And it's also got a hole in it here. This would be bilateral. We're just drawing the left side. It's going to have a caudal-free boundary, and it's going to have a little hole in it. That caudal-free boundary is what they call the inguinal ligament. It's not a ligament as in a structure that attaches bone to bone. It's running from bone to bone, but it's not holding things together. It's just and it's not a ligament. It's actually a muscle tendon, aponeurosis. That's called the inguinal ligament. That's what they're referring to. Don't look for it. Understand it in the dog. Don't look for it. We're going to see it real nicely in the horse next semester. What that's doing is there is a space here behind this ligament. So this opening here is called the vascular lacuna. My R went on to the other page. Vascular lacuna. What that is doing is it's leaving a space between this muscle and that bone because we have an artery that needs to get out from the aorta outside this abdominal cavity and down the leg. So that leaves a space for that femoral artery to jump out into that femoral triangle and down the leg. So the vascular lacuna allows the femoral artery to slip out. And it's actually the external iliac turns into the femoral artery right at that location. So femoral artery comes out from behind that vascular lacuna. So that's the significance of that space there. This hole right here, this is your superficial inguinal ring. I will talk about all those when we talk about the male system and the testicular descent. That allows the gonad to come out in males. And that is what you're seeing right here when the spermatic cord comes out the abdominal wall and heads over here towards the scrotum. So you're not going to see a nice hole. It's filled in with tissue and everything, but that's where the superficial inguinal ring sits. Vascular lacuna is up here where you can see these vessels jumping out right there. So there are those two things that we're drawing in over here. It's figure 279. So, external abdominal oblique, it's the most superficial, and its fibers are oriented, where's my paper? Caudoventrally. Caudoventrally. Now underneath this one, when you cut that and move that out of the way, I'm going to jump back over here. We're going to have an internal abdominal oblique. That muscle comes off like this, and it comes up to the costal arch. Sits like this. It does not overlap the ribs. And again, sends an aponeurosis down towards towards the midline. It does not make it all the way back here. The caudal border of that muscle is actually going to be defined as our deep inguinal ring. We'll come back to that another time. So this muscle, internal abdominal oblique, has fibers. I'm going to write it over here. Internal abdominal oblique has muscle fibers that run in a cranioventral direction, opposite that of the external abdominal oblique. Underneath that, we have the transversus abdominis. Transversus abdominis drops down transversely, and it will overlap the inside of that rib cage just a bit, and its fibers are running perpendicular to the long axis. So transversus abdominis muscle, its fibers are running straight up and down. Straight up and down. So those are 3 of the 4 abdominal muscles. External oblique here. Cut that out of the way. You see the internal obliques, and then you'll see the transversus medial to those. Transversus, once again, will send down an aponeurosis to this midline. The last muscle is the rectus abdominis. I'll come back and put it on this picture here. It's underneath this aponeurosis, and it's running from the pubis to the sternum. All these muscles are bilateral. So the 2 on rectus abdominis muscles will be sitting side by side, and it's running along the length of this animal in that fashion there. So those are our 4 abdominal muscles. Muscles of the rectus abdominis, its fibers are running in a cranial caudal direction. So rectus abdominis, cranial caudal. Now, when these abdominal muscles, the first 3 are sitting down their aponeurosis, or aponeuroses, down to the ventral midline of the dog, we get something that looks like this. And this is figure 278 out of the book. And I'm going to turn it upside down as if this dog were standing here. Hold up to the camera a bit and see if it wants to focus on that. I don't think it does. When these, if you look at this diagram, when these muscles send their aponeuroses down, they're going to surround our rectus abdominis muscle. That's what's sitting here on cross section. It's going to change the way this is happening as you move from the front of the abdominal region to the caudal aspect of the abdominal region. So this front picture, which is, when I say front, I should mean the top one, it's the front of the dog. That's the one I want you to be familiar with. And if I were to draw this myself, I'll show you what's going on. If I draw a rectus abdominis on cross section, there's another one right there. And I draw the midline of my dog. There's a line running from front to back right there. And I come up and I've got my 3 abdominal muscles up here like so. Transversus, internal oblique, external oblique. Transversus, internal oblique, and external abdominal oblique. When their aponeuroses come down, the external sends this aponeurosis ventral to the rectus abdominis. It attaches there. Transversus sends its aponeurosis to the other side of the rectus abdominis, the dorsal side, and the internal comes down and it sends a piece to each of the other 2 aponeuroses. And so we get this little package around our rectus abdominis. Same thing would happen on the other side. So the rectus abdominis has this sheath around it. And this sheath is what we call the rectus sheath. That is the rectus sheath. There's a superficial part to it, there's a deep part to it right there. Superficial part formed by the internal and external obliques at the level I want you to be aware of. The internal sheet or lamina layer formed by the transversus and the internal abdominal oblique on that side. This point here, that point that I drew, where all these things are coming together, this is what is called the linea alba. The linea alba. That is the line on the ventral midline of the abdominal region of the dog where you'll make your cut to enter the abdominal cavity. And the reason you do that, a couple reasons. If you cut right down that line, number one, you miss this muscle. Okay? If you cut through like this, you've got to come back and you've got to sew this together. Might have to do something with your muscle and come back and sew this together over here. If you come through here, linea alba, not only do you miss the muscle, you cut through one structure. You're not going to have a lot of bleeding from this blasting through a muscle over here. And when you come back to sew up on your way out, you've got this nice thick connective tissue structure to sew back together and make one nice closure here instead of closing here and there and worrying about a muscle that you've trashed in between. Now, in all actuality, when you're cutting down that linea alba, you're going to be cutting down there. You're going to kind of slip off this side a little bit and kind of come back to the midline, maybe slip off over here, come back to the midline. Stay as close as you can on that. Makes for a stronger, more secure, and easier closure on your way out. So that's the linea alba that we drew with that first black dot. That's what all these things are coming down and attaching to. So there is your linea alba, muscles supporting all of our viscera down here, and certainly when you start getting pregnancies and you get big things with arms and legs and heads and teeth in here, helps support all of that in there. Forced exhalation and all those other things that we've mentioned. So there are our abdominal muscles, and I'll go ahead and we'll end this right here. Thanks for your time.